Hi there, Mark Jamin here, Medical Director for the Haywood County Health Department. And let's talk about this pandemic. It's weekly update time again. And frankly, it's not a pretty picture. My buddy back there didn't get too excited last week at the prospect of a downturn. He stayed topsy-turvy, and unfortunately, he and Travis Donaldson were correct. Haywood County and the region are even more out of control with no end in sight, especially with festival, leaf season, and events upon us. So hang in there for the down and dirty, and please share this with everyone you care about. For the United States, everyone remains well into the red. And as if there couldn't be more red on the map, well, there is this week. 3 states now above 100 per 100,000 population new case rates. And if you hadn't noticed, Nebraska is not doing any better than anyone else. They just stopped reporting, as if that would make this go away. Reminds me of a toddler who closes their eyes in hopes of escaping what they've done. For our neighbors, Tennessee now tied with the highest rate in the country with West Virginia. South Carolina barely behind that. And if we can scrape out any good news this week, it's that Georgia is down a little bit more. Last week they had 2 counties in the orange, and this week it's up to 3, as if that is good news. North Carolina cases back on the upswing, and deaths continue to climb. For the state, there are now 23 counties, 1 out of every 5 counties in the state, above 100 per 100,000 population new case rates. At week's end, Cherokee, Graham, and Clay had the 3 highest rates in the state. And even the lowest 2 counties in the state still have new case rate above 30 per 100,000. Western North Carolina, and as if we thought cases couldn't go higher, we are now beyond even the high levels we were already seeing. 5 counties in western North Carolina now above 100 per 100,000 population, and no one below 50. As far as testing, everyone's still above the 5% threshold, some really high, indicating not enough people are being tested in their counties. Their numbers that you see here are likely far worse, far higher than the already reported high figures that we see. Haywood County, total for the pandemic, 6,383. That's an increase of 363 new cases for the week. We have now been at really high levels for almost 4 weeks, twice as long as the 2 weeks we experienced at our peak last January, and we thought things were bad then. We continue to see increased cases above the exponential line, which means cases are getting worse at a faster pace. And no wonder the healthcare system is stretched to its limits. And note the sharp upswing in week-over-week increases. As well, the number of children infected has gone up considerably. Hospitalizations too, but fortunately no deaths among the kids so far. Speaking of deaths, Haywood County reported the most deaths in a week since the pandemic began. 12 reported, for a total now of 127. 10 of those 12 not vaccinated. Ages ranging from mid-40s to 80s, with an even spread among all the age groups. And the 2 who were vaccinated were very elderly and had significant health issues. And what about the deaths that are not COVID, but the result of an overstretched healthcare system? Speaking of that, Haywood Regional Medical Center continues to have 20 to 30 COVID-related admissions, with 5 on ventilators at week's end. Patients are younger, sicker, and having to be in the hospital longer. Hospitals around the region spend much of their time on diversion, mission included, and EMS units are either waiting hours to unload patients or spending hours taking them wherever they can. We no longer look like the UK or Missouri. We look worse. And if what we saw 2 weeks ago was our downslope, it was short-lived. It only served to set the platform for the skyrocketing spike you can see this past week as the full effect of Labor Day weekend becomes clear. I'm sorry to say this is a bleak time on the pandemic front here. Some places around the country, like Idaho, are having to make the heart-wrenching decisions about rationing care. Idaho, a place with low vaccination rates and high denial when it comes to COVID. So don't be surprised when it happens here to someone you care about here. You know, everyone is tired. Tired of paying attention to this. Tired of caring for people, some of whom were being careful, most who aren't doing their part. Tired of the onslaught of illness and suffering. With festival season upon us and continued flood recovery efforts, we are likely poised to go even higher. Right now, the Georgia Tech Event Risk Calculator indicates in Haywood County, in a group of 50, there's a 75% likelihood someone there is infected. And in a group of 100, greater than 90% chance, almost guaranteed that that will be the case. So let that sink in for a moment. Just about everywhere you go, the likelihood is that someone there is infected. Unless each of us chooses to continue to remain vigilant, and those who have not choose to reconsider in light of what's happening, unless those putting on gatherings and events do everything possible to lessen the risk at their events, and those who attend do the same, where and when will this slow down, much less end? I've said it in every video, be well and be careful, and there is no better time than right now.